I talked a lot about the benefits of hormone pellet therapy, but there are some downsides. So that is why maybe hormone pellet therapy is not for everyone. Number one, it will likely not get covered by a health insurance company, so it's probably going to be expensive. The hormone pellet therapy can be a little painful. Most of the time, it's just a little soreness at the site. By the way, it's inserted right here at the back of your upper buttock area. There are some people who insert them in the lower abdomen. There are too many blood vessels in here. We don't want to mess with those. So when I got taught, it was very simple. We got fat here. There's no funky blood vessels. We got fat here, but lots of funky blood vessels. We don't want a hematoma. So long story short, this is much safer than any abdominal insertion. That being said, it could be a little painful. And I've had patients who occasionally, once in a blue moon, there's a little hematoma that forms. There's a little cellulitis that forms. There's always a risk of infection. Once you break the skin, there's always a risk that the skin can carry bacteria into the deeper tissues. And depends on the body's immune response and depends on how that specific person reacts. There's always a risk that we might end up with some kind of a mild infection, cellulitis, and that's uncomfortable. You have to treat it with antibiotics. You have to catch it early. Sometimes patients wait for a week to tell us, hey, I got a problem. This is kind of red and it kind of hurts. Is this normal? Once in a blue moon, very rarely. I think I had 2 people that were in that circumstance. They got an infection from their first pellet insertion. And obviously they got like scared off. They're like, I don't want to do the pellet again. On the other hand, if you've done this for a few years and you realize the benefits of it and you're like, it feels magical, I love it in my body, it does help me a lot. When you do have an infection that's treated and it's resolved positively, which always is in 100% of the times, then you realize, okay, well, this is a fluke, it's a one-off. So it doesn't necessarily scare you off. But those happen, they do happen. I'm going to say the chance is less than 1 to 2%, but they do happen. So hematoma, infection like cellulitis. And then one of the biggest things that really pisses people off sometimes is a pellet expulsion. So what is that? Well, you put it in, pops right out. Not right out. Sometimes it pops in a week, sometimes in 2, sometimes it's 6 weeks, which is surprising. The pellet needs to settle in the area where it's inserted. So we always make a small incision and we insert the pellet this far off from the incision. So the trocar, which is a large bore needle, penetrates the skin at least about this much under the skin into the fat tissue. So the pellet is